Food insecurity has become the top social determinant of health, and health systems need to recognize that. We at Northwell recognize it. Food insecurity can take many forms. It can be inability to purchase food, not having enough financial resources to buy food, and it depends on the community member, of course, where they live and what their access is. Are they employed? How much they earn? It can also mean that you don't have healthy food available to you because you live in a food desert within your community. When you're food insecure and you don't have consistent access to the right amounts of food or the right quality of food, then chances are you're not going to control your diabetes very well, your blood pressure very well. Many of the chronic conditions that we treat in underserved communities and in other communities are affected by the type of food you eat. In children, the rates of pre-diabetes, which of course leads to diabetes if unchecked, and the rates of diabetes themselves. And if you look at economically disadvantaged communities and minoritized communities, the rates are sometimes twice the rates of the U.S. We have school districts right in our local region where 60% of their high school students are either overweight or obese. What can health systems do? First, recognize that it's an issue and that food is health. The second is that we have to listen to our communities. Until you listen, really listen, you may not understand what's important to them, what's important to a child. Food insecurity can happen over a weekend when a kid is not in school and they don't have access to the breakfast or the lunch that's served at school. I think the other thing, once you recognize it and once you work with other organizations on what we can do about it together, is cultivate others who can join us, who can support these efforts, like Wellness on Wheels.
Ready? Drop your planted.
A mobile community outreach and education targeting kindergarten to fourth graders in elementary schools in economically disadvantaged communities, to provide them with an interactive opportunity to learn about eating healthy and being fit. And we purposefully go into communities that we know food insecurity is an issue. The WOW program is mobile. We meet people where they are with the program. And supporting the efforts can be in-kind support, volunteerism. It can be financial support so we can expand the program. The Wellness on Wheels program is just one way that we are showing our community that we care, working with other donors and other corporations to support the work and to expand the work.